Review.
Marine Envenomations, Vertebrates by Joseph Becker and Paul Auerbach. Many marine vertebrates are equipped with toxin-based defense mechanisms. While caution, a healthy respect and distance are usually adequate protection from these creatures, accidents happen, leaving some divers envenomated with potentially serious medical effects. Knowing how to provide first aid in these situations can hasten recovery and prevent complications. There are some general treatment principles. For the most part, marine vertebrate venoms are comprised of many bioactive chemicals, including one or more proteins. The toxic effects, such as pain, manifest through the destruction of local tissue or the irritation or disruption of a person's peripheral nervous system. In general, treatment goals are to remove as much of the active venom as possible and to reduce its effects. Pain is reduced by irrigating the affected area with hot water to the level of tolerance without causing burns. In addition to pain reduction, this also serves as a first step, followed by scrubbing and extracting of the spines. And this removes the venom and potentially infectious organic foreign material. Symptoms may result from direct toxic effects of the venom. In addition, venom may cause an allergic reaction in a manner similar to that of bee stings. The reaction for some people may only be pain and swelling, while others may experience potentially dangerous respiratory distress. Most allergic reactions involve only skin symptoms, such as swelling, rash, and itchiness. Reactions that are severe enough to cause breathing distress are rare, however. When they do occur, first aid support may include injectable adrenaline or epinephrine, inhaled oxygen, and an antihistamine, such as diphenhydramine or Benadryl. In addition, a steroid such as prednisone may be administered. Regardless of what first aid is administered, any patients with serious allergic reactions should be treated by a physician as soon as possible. Stingray envenomation. Stingrays are beautiful and graceful creatures, but their tails carry barbed spines with two ventrolateral venom-containing grooves. When they're provoked, a stingray thrusts its tail into the victim, producing deep, jagged lacerations. Removal of the spine is often dangerous because the sharp barbs produce significant tissue damage. Potentially serious bleeding may occur when extraction is attempted. Attacks usually occur to the foot or lower leg, and this is because stingrays are usually buried in sediment or sand and then are stepped on unexpectedly. Stingray spines impale deeply in any tissue, particularly if it's in the abdomen or chest, should be removed only under controlled medical conditions, such as an emergency room. Stingray envenomations usually cause significant pain, but they're rarely fatal. Effects include local tissue damage, as well as neurological and musculoskeletal symptoms. Immediate treatment should focus on washing the wound vigorously with clean, fresh water. Immerse the wound in water as hot as can be tolerated, about 45 degrees centigrade or 110 degrees Fahrenheit. This sometimes provides relief for up to 90 minutes. Remove as much of the spine and foreign material as possible, and then scrub the wound with soap and water with heated fresh water. Wounds should be left open unless packing and bandaging are necessary to reduce bleeding. If significant tissue damage has occurred, that is, if there is damage to deep structures or muscles or subcutaneous fat, or if the victim has an impaired immune system, such as the result of diabetes, HIV, cancer, or the regular use of steroid medication, then an antibiotic should be considered. After stingrays, the Scorpionfish family is responsible for more envenomations than all the other marine vertebrates. This group includes lionfish, scorpionfish, and stonefish. Lionfish have the smallest spines and least toxic venom, while scorpionfish have shorter and thicker spines and larger venom glands, along with more potent and toxic stings. Stonefish have significant spines and cause very toxic and potentially injurious envenomations. In general, the severity of envenomation depends on a variety of factors. It includes the envenomation site, number of stings, and underlying health of the person who is stung. Lionfish envenomations may cause significant pain, but they are rarely fatal. Scorpionfish and stonefish stings in general are felt to be more serious, although the available literature on the subject suggests that the number of actual deaths that are directly attributable to the envenomations is likely to be lower than is commonly believed. This, of course, excludes individuals who drown as a result of the pain of the sting. Systemic symptoms such as nausea, vomiting, and weakness are usually more common in scorpionfish and stonefish envenomations than they are in lionfish stings. First aid for scorpionfish envenomations follows the same protocol as for stingrays. Irrigate and immerse the affected area in hot water, remove foreign material, and scrub the wound. Leave the wound open, and if the wound appears to become infected, administer antibiotics with activity against marine organisms. Antivenom for stonefish stings is available in South Pacific and Australia. While this therapy is helpful in the majority of cases when it's used, it should be administered only in a hospital setting because of the potential for serious allergic reactions. Catfish and weaverfish are two other types of fish capable of delivering significant envenomations. Catfish species are found in both fresh and salt water. They have dorsal and pectoral fins that may result in puncture wounds, particularly when the creature is handled. The venom of most catfish is considered to be fairly mild, generating symptoms comparable to those of a bee sting. Weaverfish are somewhat aggressive and some of the few fish that may attack divers without provocation. However, most stings occur when divers or swimmers step on the fish, which is typically buried in sand, awaiting prey. Weaverfish venom is toxic to the nervous system, so symptoms are primarily neurological in nature. Itching, tingling, and severe pain at the wound site are common. Systemic effects are less common, but may be serious, involving respiratory difficulty or paralysis. If treating a catfish or weaverfish sting, administer the same first aid principles as for scorpionfish. The best approach to all marine vertebrate envenomations is to avoid contact with potentially toxic creatures. In the event of an encounter, remember that most marine vertebrate envenomations involve significant local pain, with tissue swelling and minor damage. This may respond promptly to hot water immersion. If a victim seems more than minimally ill, or if you are in doubt, seek immediate medical care to assist with treatment.